Exercise and Sports Science Australia is the professional body that represents university qualified exercise and sports science professionals. Accredited Exercise Physiologists are university-trained allied health professionals who specialise in exercise interventions for those with chronic diseases, illnesses or conditions.
I'm passionate about the profession because I believe that physical activity can make such a difference in the lifestyle of people, both to prevent and to manage chronic disease.
I get to apply something that I really love doing and use exercise as a tool to improve their health, their physical function, their psychological well-being and their quality of life.
I enjoy that whole problem-solving kind of challenge and using exercise as a conduit to improve and improve people's health.
We've worked in partnership with exercise physiologists since 2009. In that time we've worked really hard to deliver quality health programs that really encourage people to engage with and invest in lifestyle change.
Well, one project that I coordinated with the Illawarra Division of General Practice was the GP-EP Diabetes project. Now, we achieved over a 12-week treatment cycle reductions in HbA1c in the order of 0.8%.
Accredited exercise physiologists have a huge role to play in exercise, in the role of exercise for cancer recovery. One of the randomised clinical trials that I think is particularly relevant to talk about here is one that we've recently completed, and it's called the Exercise for Health trial. This Exercise for Health trial evaluated what we call a pragmatic exercise intervention, meaning it was an exercise intervention that replicates what would happen in the real world, could take advantage of the primary enhanced healthcare plans, could take advantage of private health rebates that people can get from their private health company. We found significant benefits in quality of life and function outcomes, functional related outcomes, from participation in this exercise intervention.
So my role as an accredited exercise physiologist is multifaceted. I run a pulmonary rehabilitation group a few times a week, which is a maintenance class for those with respiratory conditions. Within our program, we've found that our patients have been improving significantly on their ability to walk and to complete a larger amount of distance in 6 minutes.
One of the other ongoing projects that I've been involved in as an accredited exercise physiologist has been as a clinician at various medical centres throughout the region where I work, the South East region. And I've worked on a weekly basis with GPs and practice nurses delivering enhanced primary care programs for their patients.
Well, just recently I've conducted a transitional research project into mental health and severe mental illness and how exercise physiology and dietetics can all come together to bring meaningful outcomes to people with severe mental illness and reducing their cardiometabolic risk. So that's definitely an area where we're going to see some growth.
Accredited exercise physiologists are the most qualified of the allied health professions to prescribe exercise for the prevention and management of chronic disease.
In my experience, they're excellent team players and have a sound understanding of behaviour change practice and principles that they can bring to the program. I was really impressed with their level of skill and their capacity to work with individuals either at risk of or with existing chronic diseases.
Well, I definitely see an increasing role for the accredited exercise physiologist in the healthcare sector, and that's not just in primary care. I think there are other avenues such as workplace health, as I mentioned, preventative health, as well as in the defence forces and in aged care. And I think with an increasing workforce, we'll be able to meet that demand and help to make Australia a healthier community.
My vision for health in Australia is really focusing on preventative health. There's no need to leave it till someone is sick. We can get in there now, educate from the school level up around preventative health and providing programs to get people active and to be eating properly. It's also around moving into areas we haven't really focused on, particularly for physical activity, and that is in the aged care and in mental health, which is growing.
My advice to Medicare Locals is that this group of professionals are certainly jewels to be considered in the mix of allied health professionals.